Hello everybody, my name is Kelsey Peabody, as you all know, and I'm doing a presentation on patient advocacy today on behalf of Boise State University. I chose this topic because I'm super passionate about it and I love this portion of my job, and I think it's very important in your everyday nursing job. My goals and objectives for today are to teach you what patient advocacy is, learn how it affects your job as a nurse, the importance of patient advocacy, how it affects the outcome of the patient, and then also how to advocate for your patients. What is patient advocacy? In nursing, it has been defined as being a patient representative, defending the patient's rights and universal rights, protecting the interests of the patient, contributing to decision making and supporting the patient's decisions, ethical centered skills for the professional self, and being a voice for the vulnerable. As a nurse, you're at the forefront of this every day. So you're there to help your patient and get them the best care that they need and provide them with what they want for their care by communicating with other disciplinaries or the doctor or whatever it may be. That's what you're there for. How does patient advocacy affect your job as a nurse? It can put you in some uncomfortable situations if you don't agree with the patient. Or if the doctor doesn't agree with the patient and they're not agreeing on things, that can be uncomfortable. You can have to be confrontational sometimes, maybe communicating to the family and helping them understand that that's what the patient wants and needs, all sorts of different things. Sometimes you have to educate about stuff that you're not 100%, so you have to go do some research yourself and then come back and educate your patient. You're the voice for your patient, so communicating what they want and need to the doctor or to physical therapy or occupational therapy or maybe pharmacy. Maybe pharmacy has their medication wrong. You are their voice and you need to help them help themselves because that's going to create the best patient outcome and that's why we're here. You have to put aside your own beliefs, like I mentioned before. You can't project your beliefs on this patient because maybe that doesn't work for them, and that's why they don't do it that certain way. That's probably the hardest part about patient advocacy. And you never thought you were going to go into nursing and become an educator, but it's part of your job, and it's part of patient advocacy. And it's a big part of patient advocacy. I've had patients refuse stuff because they don't understand. So you educate them. What is the importance of patient advocacy? So healthcare equality for all patients. This part of patient advocacy is not direct patient care. It's going to committees and stuff like that, and making sure that we, as the healthcare system, can provide the patients with the healthcare that they need, or regardless of their socioeconomic status, race, sex, etc., etc. We want that for the future of our patients, and we want them to get the care that they deserve, regardless of those statutes. Alleviation of suffering. So this is where you catch mistakes in the healthcare system so that your patient doesn't suffer, whether it be maybe the wrong surgery, wrong medication, all sorts of stuff like that. You intercept there and create a safe environment for your patients so they don't suffer for something that they didn't need. Promotion of human dignity, so giving them a right in their care, and this goes back to being their voice and communicating with other disciplinaries what they want in their care and making sure that the patient knows that they have a voice in their care because if they feel that they don't have a voice in their care, it's not going to go well. And then promote positive outcomes. So while you're doing all of these things, it always is going to promote a positive outcome, and that's why we're here, for a positive outcome, as positive as it can be for their health. Obviously, you want your patient to go home and be well and back to their baseline, or maybe their new baseline, and have a happy life, and have them not being returned to the hospital constantly. How does it affect the outcomes? Is it good or bad? Well, I think I've already went across that, but it's definitely good. So I'm going to create a scenario. So you have a patient, they have a hip fracture, and they came in and they got surgery. They were there for a couple days to get back on their feet, and then they're headed to a rehab facility to get better. So they also have congestive heart failure, and you notice that they're a little swollen, but you contribute it to them going through the surgery and the fall and all that sort of stuff. But the patient speaks up and says, hey, I normally take Lasix at home, and I don't think I've had it since I've been here. Can you check for me? And you say, sure, I'll look into it. You look into the med rec and you don't see the Lasix there. It hasn't been given while they've been here. And so you say, all right, I'm going to call the doc and see what we can do for you. So you get the Lasix on board and everything's good to go. Let's say for some reason that didn't happen. Maybe you got busy, forgot about it, whatever it may be, and it didn't happen. And the patient thinks that you talked to the doctor and nothing changed, so they're like, okay, well maybe they don't want me on it. And then it's caught later on by changing the patient's status, which is not a good thing. So then that is bad because your patient's health is declining due to the lack of patient advocacy in this situation. So it's always going to be a good thing for you to be a patient advocate. Keep that in mind. How do you advocate for your patient? Ensure their safety, give them a voice, educate them, protect their rights, double check for errors, and connect them to the proper resources. How do you ensure their safety? Well, you can do this while they're with you in your care by ensuring fall precautions so that they're safe mobilizing around the hospital while they're in your care. Double check medications, make sure they're getting the right dose, all that sort of stuff. And then also communicating with other disciplinaries so that when they go home for discharge, that they have what they need to be successful at home and not return to the hospital. How do you give them a voice? So you can do this by staying in the room when the doc comes and listening. And then when the doc leaves, say, hey, is there any questions? Are you confused? Do you need time to process this? And you can ask me later, that's fine. You can also stay in there, and if they had questions previous to the doctor being there, make sure that those questions are being asked, because you as a nurse can't always answer all of the questions. And then also making sure that they have a voice in their care as to what they want and need to help them be the most successful that they can. Educate. Educate your patients. This is probably one of the most important about patient advocacy. I don't know how many times I've had a patient refuse some type of procedure or medication due to the fact that they don't understand what the procedure and medication is for, which I totally understand. I would be the same way. I'm not going to do something that I don't understand the purpose of it. So educate your patients. It's very important to the outcome, a good outcome for them. Protect your patient's rights. So you can do this in a couple of ways. You can protect their rights by helping them explain to a family member a choice that they have made in regards to their health that maybe the family member doesn't agree with. You can also protect their rights if the doctor is wanting to do something to them that they don't agree with, and you voice that to the doctor and explain to the doctor why they don't want to do it. You're always there to protect their rights, and that's why we're in the field that we are in. Double check for errors. So I bet when you first saw this, you probably thought it said stop, but it doesn't. Be careful of that. Just like in real life, it happens in the healthcare field. It's super easy to miss, but it's very important that it's not missed. Always, 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 always question everything if it doesn't look familiar to you. The most you're going to do is annoy somebody, but at least you annoyed somebody instead of killing your patient. And your patient is safe. So, always question everything. I know as a new grad, I feel annoying all the time because I'm always asking questions, but it's very important to your patient's outcome and if you want to practice safely. And then connect your patients to the proper resources. So the situation I came across the most in as a floor nurse is a patient will ask me something about their insurance, which I have no idea about because I don't do anything with insurance, but I can connect them to case management, who can then help answer their questions and go through that process with them. Another resource that you can connect them to is like a pastor if they need if they have religious needs. You can do that as well. You can also connect your patient to the doctor if they feel that they need to talk to the doctor, and that's going to be their best resource. You can contact the doctor and say, hey, my patient would like to talk to you or whatever. I believe the most important that this plays a role in is when they discharge, and I think that a lot of places fall short of this. Connecting them to the proper resources upon discharge is very, very important for the healthy outcome of your patient. You don't want them returning to the hospital with the same problem. So if we connect them to the proper resources, then we can have a successful outcome with that certain diagnosis. I noticed this fall short as a floor nurse when I am reading the discharge instructions and they're asking, why this medication change or why this or why that, and it's not always written there, and I honestly don't know where to point them. So I know I fall short in that aspect, which hopefully sometime will change soon, because I want to be able to give my patients the best education and resources that they can have upon discharge so they can be the most successful. So again, what is patient advocacy? The protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Again, this is probably the most important aspect of the nursing field. Honestly, it's just as important as doing an assessment, and I hope that all of this information will help you in the future of your nursing. And thank you for watching my presentation, and these are my resources.